Welcome to Dentistogenesis, guys. In this session, we'll be learning about pemphigus. So, pemphigus is basically a vesiculobulbar lesion, and what is a very basic definition or a very basic term of pemphigus is that it is a skin disease which is related to vesicles and bulbous formation on the skin. See, these are blisters on the axilla. A vesicle is a enlargement of the skin which is less than 0.5 centimeters. A bulbous is a lesion which is called if it is above more than 0.5. See, pemphigus is nothing but a autoimmune B cell mediated disease in which the IgG antibodies are directed towards the keratinocytes on the skin. If this is a skin layer, there will be a keratinocytes are present. But our body, which develops an autoimmune disease in our body, prepares an IgG antibody against these cells in the skin, causing the cell will get lysis due to formation of IgG antibodies. So immunologically, pemphigus is a IgG, so it circulates IgG antibodies in the body, which are directed against the surface keratinocytes. So now, pemphigus, the word pemphigus means pemphics, which is a blistering or a bubble. So introduction of pemphigus include it is an autoimmune disease. Clinically, it is a blistering disease. So it is autoimmune due to production of IgG antibodies against the keratinocytes on the skin, which causes blisters on the skin. I did tell you what is a blister mean. Blister could be a vesicle or a bulla. What is a vesicle? If the inflammatory thing is less than 0.5 centimeters, less than 0.5 mm, that's a vesicle. And if it is greater than 0.5 mm, it's a bulla. So these are blisters on the skin, which is a fluid containing inflammation on the skin is known as a blister. So clinically, it is a blistering disease. So it targets skin and mucous membrane and oral cavity and genitals. Histologically, it is an intraepithelial vesicle disease where we have stratified epithelium, underlining we have normal cells, and underlining we have basement membrane and then connective tissue. Now this disease will be affecting the cells between the stratum, this layer and the basement membrane. So these cells will be affecting in pemphigus. So immunologically, it is an IgG antibody mediated disease. So it targets keratinocytes in the skin. It targets keratinocytes in the skin. And how many patients will be affecting by this is 0.5 to 3.2 per lakh. So now coming to pemphigus variants. Now first one is pemphigus vulgaris, which is a common disease, and its variant is pemphigus vegetans, which affects the oral cavity. And then pemphigus folius, which is Phogosalavism. Another variant is pemphigus erythematus. And now paraneoplastic pemphigus associated with the Hodgkin's lymphoma and also CLL, which is chronic lymphocytic leukemia. So now these are the common and most affecting pemphigus in the patients. And the other two are IgA pemphigus and pemphigus herpetiform. Now these are the 5 variants of pemphigus. Now significance of pemphigus include, as we discussed earlier, pemphigus vulgaris is the most common form of pemphigus and it is an oral lesion and it could cause erosions and ulcerations. And now 50% to 80% precedes the skin lesion. First to show and last to go. The oral lesions which are produced in pemphigus are the first symptom or sign of pemphigus, which will be last to go or last to cure after the disease is cured. And now, pemphigus vulgaris is an autoimmune, as we discussed earlier in the introduction. It is an autoimmune intraepithelial blistering disease on the skin and mucous membrane, mediated by IgG antibodies onto the keratinocytes. This is the most important point to be written during written during answering the pemphigus. So IgG antibodies are mediated onto the keratinocytes. Now when I come to pathogenesis, now there are an on or two antibodies are directed against desmoglin 3 and 1, which are main for intramolecular interaction responsible for the cell adhesion, which leads to intraepithelial split and suprabasilar split. See, now this is in cell, then this is in other cell. This is the desmoglin and this is also a desmoglin which adheres the cell together, and this IgG antibody attacks this desmoglin causing the intraepithelial split. They attack the in the inner layer of the cells. There will be presence of desmoglin 3 and 1, which are reason for the attachment between these cells. Now these IgG antibodies will be attacking the desmoglin 3 and 1, causing the intraepithelial split or suprabasilar split. But the basement membrane is intact, to remember. Only the cells will be splitting up, but the basement membrane and connective tissue will be intact. Now, what are the predisposed factors for pemphigus? Or usage of drugs and irregular diet, radiation, stress, surgery, pregnancy, virus, and pesticides. Exposure to pesticides. Clinical features include most of them who are 50 to 60 years of age will be affected by pemphigus, and all races will be affected, and there is a male to female equal ratio. Presentation include uh, as earlier discussed, vesicles and bulla are formed or appearance, and it could lead to to centimeter. These could be enlarging from to centimeter. And these lesions contain the vesicle and the bulla contain thin watery fluids, and after development they could become purulent or sanguineous, which include blood, or they could include pus. Bulla rupture, it is raw and eroded surface. If bulla ruptures, it could cause the skin would be raw and eroded on the surface. Oblique pressure could include Nikolsky sign. See, Nikolsky sign. See, this is Nikolsky sign. When there is a bulla or there is a vesicle, when we put lateral pressure with our fingers, it reveals a moist base. A moist base is revealed. Now this is this is the lateral pressure on the skin, on the top layer of the skin. It removes the top layer and reveals the moist base. So this is a Nikolsky sign of Pemphigus vulgaris. It's a positive indicator of Pemphigus vulgaris. And now this is not seen in pemphigoid, but is an indirect Nikolsky sign. So there is this is a skin and this is a blister. When there is a lateral pressure is applied, this bulla is displaced to here. So now other bulla is formed, then this could be flat. So how it will appear? So now this bulla which is present before when the lateral pressure is applied, so when the lateral pressure is applied, now this displaces over here. So the blister displaces to adjacent side when the lateral pressure is applied. So now pemphigus vulgaris can be terminating in death to or recovered within a few days, weeks, being prolonged over a period of months to years. It could take months and years to get recovered. If it's not recovered, the patient could lead to death. Now, when I come to oral manifestations of pemphigus vulgaris, now as we seen earlier, mucous membrane is commonly affected for 50 to 70%, and mucosal layer, mucosal to it spreads to mucosal to cutaneous in months only. Intact bulla are rare, mostly affected. Well-defined, irregular shaped, this bulla could be affected on gingiva, on the buccal, and on the palatal erosions, which are painful and slow healing. These erosions extend peripherally, and any part of the oral cavity is scattered and extensive. These erosions are present in the oral cavity in the form of scattered, and there could be extensive bullas are also present. Erosion spread into larynx with subsequent hoarseness of voice, Patient unable to drink, eat. Other mucosal surfaces include conjunctiva, esophagus, labia, vagina, cervix, and penis, and urethra and anus. It could spread. These are all the mucus cavities, no? So they could spread into any of them. Now, Pemphigus vegetans, which is a uncommon variant of Pemphigus vulgaris, which is 1 to 2% only. This is seen only on the tongue. Pemphigus vegetans is seen only on the tongue, which is 1 to 2% of the population would be affected. Median range include the age of 40 to 50%. Sorry, 40 to 50 years. Oral variant. This is an oral variant and present in all the cases. Pemphigus vegetans show a characteristic pattern of sulcus and gyri, and this is important. Pemphigus vulgaris shows sulcus and gyri. Where do we see the sulcus and gyri? In the brain. But the same characteristic is seen on the tongue. So, if the sulcus and gyri pattern is seen on the tongue, that includes Pemphigus vegetans. Which part of the tongue? Dorsum part of the tongue in a cerebriform. So now that tongue is called a cerebriform tongue. If the sulcus or gyri is seen on the dorsum of the tongue, it causes cerebriform tongue. And now there are two types of Pemphigus vegetans, which is Newman's type and Halopian's type. It is a cauliflower shaped lesion. It also, the Pemphigus vegetans also causes cauliflower shaped lesion in the axilla and the inguinal lesions. Come to histological features which are very easy to remember in the case of Pemphigus. The first point include intraepithelial vesicle formation in the suprabasilar layer. So now this is a suprabasilar layer and there is an intraepithelial vesicles. These are all the vesicles. Now, spinous cell layer leads to acantholysis and destruction of intraepithelial junction is seen, which causes separation of the cells. Now, which is a spinous layer? So now this little layer is a spinous layer which causes acantholysis. What is meant by acantholysis? Destruction of the intraepithelial cells. It leads to acantholysis and destruction of intraepithelial junction. So now this cell have a junction, but seeing here, this cell and this cell doesn't have a junction. So destruction of the intraepithelial junction and separation of the cells. Loose cells in vesicles appear round, degenerative like enlarged nuclei and hypochromatic staining. So now these are enlarged in size and also enlarged in nuclei and they are hyperchromatic, which have a larger nucleoli and they are hyperchromatic. Now these cells which are acantholized, like these are not similar to these normal cells, so these are acantholized. So these cells are called as Zang cells, which are a characteristic feature of Pemphigus. So these are called as Zang cells. Inflammatory cells in vesicles and subepithelial connective tissue. So now here we could see inflammatory cells and here also we could see the inflammatory cells. So there are many inflammatory cells in vesicles and subepithelial connective tissue. And now what is the difference between pemphigoid and pemphigus? So now this is a basement layer which is intact with the connective tissue. But in pemphigoid will not be seeing the basement membrane is not attached to the connective tissue. But in pemphigus it is intact with the connective tissue. So the basal layer is intact and attached to the connective tissue. Now these cells which are present on the basal cell layer have a tombstone-like appearance. So now where do we see tombstone appearance in another lesions is OKC. Odontogenic keratocysts also have a tombstone appearance of the cells. Now this is a histological features of Pemphigus. Also, now diagnosis. How do we diagnose Pemphigus? Means histopathology in the presence of histopathology for presence of Zang cells will be saying. In immunofluorescent test we'll be seeing for antibody antibody IgG and C3 in the intracellular spaces between the cells we'll be seeing for IgG antibodies. And between epithelial cells, it looks like a chicken wire and fishnet appearance. If I'll be showing you. And now this is a fishnet appearance. So this does appear like a chicken wire and fishnet appearance, and this appearance shows that there is a presence of IgG antibodies between these cells. So there is a IgG antibody between these cells where the green or the bright neon color says that there is a presence of IgG between these cells. Now, so chicken wire and fishnet appearance, indirect immunofluorescence. If this is for the immunofluorescent test, if we do an indirect immunofluorescent test, we'll be seeing an circulating IgG antibodies. So treatment of pemphigus include a very known treatment. High dose of systemic corticosteroids are prescribed, which is, for example, a prednisolone could be given, and immunosuppressive drugs, as it is an autoimmune disease. Immunosuppressive drugs could be given, so called as steroid sparing antigens should be given, and monoclonal antigens such as target B lymphocyte, as it is a B cell mediated autoimmune disease. Target B lymphocyte should be given. Example like rituximab. And also chronic, it is a pemphigus is a chronic disease which could cause remission after 10 years. So it could cause remission, and that sign could be inflammation or exacerbations after 10 years could be seen. So now this is about pemphigus. So now this is notes for pemphigus vulgaris. So thank you, and do like, do share, do comment, and do subscribe to my dentist or Genesis. And if you have any queries, if you have any suggestions to give me, please drop it in the comment section. And bye.